letter came with two other forms. It came with a safety leaflet and also a leaflet which explains what an MRI scan is. When I read through the safety form, I was relieved to find that none of it applied to me. I could say no to all the questions about had I had heart disease or diabetes. It made it very clear that I was going into a big magnet and anything metal on me would cause trouble.
The safety form is vital to a patient having a scan. This machine is a large magnet and can cause some problems if you go in there if you have some metal that we don't know about.
I have come sometimes by car, but it's a busy hospital, and although there are big car parks, sometimes it can be hard to find a space near where you're going. So if I can, I come by public transport or on my bike. They send you a clear map, and it's straightforward to find out where you're going, although it seems a very big site. I found it best when looking for the reception to go to the main entrance of the hospital and then to ask in the first reception point, which is a guide to the whole hospital, because each department has its own reception and you can end up queuing in the wrong reception queue if you've chosen the wrong department. First of all, I had to confirm my identity. So they ask your name, but they also ask you to confirm who you are by your date of birth and your address and your GP, which reassures me that I'm always being dealt with from my notes and about my condition.
My first priority when accompanying a patient into the scanner are to get them comfortable with that environment, to make them feel as though they understand everything about the procedure and take away any feelings they may have that could be causing them problems.
Before you enter the scanner, they take you to a cubicle and ask you to take your shoes, and in my case I took my trousers off because I was wearing jeans with metal studs and a belt. So I was in my shirt and underwear, and then I was given a hospital gown. I didn't need to wear a gown, I chose to wear one. I think that if you come in your own clothes that you feel comfortable in, which have no metal in them, then it's perfectly okay to stay in what's comfortable for you. They then collect all your things together and put them in a safe, locked cubicle. So I always felt that anything that you bring to the hospital is safely looked after while you're having the MRI scan. For the kind of MRI scans I've had, I had to have a contrast dye put into my arm. I was worried about that the first time it happened, and I realized that the radiographers are doing this many times, day in, day out, and they get very skilled at it. They hook up the cannula to the machine that injects the dye. It's not painful, and you're hardly aware of it once they've inserted the tube that gives the dye.
Patients sometimes need the injection because of two reasons. One, to slow down the bowel if the pictures of the bowel are being taken. And secondly, it gives a different type of picture, information that you don't get from a normal scan by having that injection.
When you go into the room where the scanner is, there's a long bed with a pillow on it, and they lower that down so that it's easy to sit on it and swing your legs round, and they show you where to lie. You're probably going to be in there maybe 20-30 minutes, so they want to know that you're comfortable because you have to stay still for some of the time while you're in the scanner. When you're prepared for going in the scanner and lying on the rolling bed, you're given a bulb to hold in your hand, which is your way of communicating with the radiographers in the control room. If anything happens or you're uncomfortable or you want to talk to them, you have immediate connection with the control room and they can get you out of there within seconds.
There are two things that you have at your disposal. There is a microphone within the scanner. It's not excellent, and we also give the patient a buzzer so as they can get in touch with us absolutely immediately by squeezing that buzzer during the scan.
I was a bit apprehensive about how narrow the tube is that you go into. Now, it's open at the bottom end and at the top end so that you're not shut in. If you relax and realize that that's all there is. There are no moving parts. You just have to lie there. I found it wasn't a problem, and I just closed my eyes and felt like I was lying on a bed anywhere. The noise when you're in the scanner is a kind of banging sound. It is a bit like a road drill, although not so high-pitched. It does sound as though somebody's trying to get in and banging on the outside of the scanner body. It's the cooling of the magnets that's going on. So once you understand that, then you relax. You aren't nearly as aware of the noise as I thought you would be, because they put ear protectors on your ears that muffles the sound, and you can also listen to music, and the radiographer is also talking to you. So once you relax about the sound, you're less and less aware of it, and it's not a problem. When you're having a scan, the machine needs you to keep still so that the pictures aren't blurry. But that doesn't mean that you have to be absolutely rigid all the way through. The radiographer is taking several scans of you, and these happen in batches of 2 and 5 minutes, and in between you can make yourself comfortable. I've learnt that it's important while the scan is going on to stay still, but you don't have to keep completely still for 30 minutes. The radiographer will say, we're now going for a 2-minute scan, and you hear the machine start, then you're careful to stay still, and that's fine. There's no problem. When you come out of the scanner, in the control room, the machine is collecting all the computer data that has been generated about you. The results from the machine have to then be seen by a radiologist who interprets what he sees or she sees on the screen, but it often also goes to other experts who then meet and decide what the meaning is of all the information they've collected about you. Although I felt I wanted the answer straight away, I thought it's worth being a bit patient until they have gathered all the information and thought about what they can recommend for you to do.
The results of these scans go to our radiologists to look at. They then write a report that gets sent to the referring consultant. I think the best piece of advice I could give to any patient is to ask as many questions as you need, make sure you understand everything that's going on around you, and then relax and enjoy the procedure.
I found that when I was offered an MRI scan, it produced a lot of really important information about my condition. So if your doctor invites you for an MRI scan, I would strongly recommend going along and having the scan. It's slightly uncomfortable, but that says nothing compared to what a brilliant way it is for doctors to find out what your condition is and therefore to choose the right treatment for you.